Hi, this is Dr. Anna Kim, Washingtonian top dentist. I wanted to mention something about root canals. Root canal does have a pretty bad reputation that it is often perceived as a painful procedure and something that is unpleasant. So root canal is basically, we go into the tooth, we clean out the bad tissue, like bad pulp inside the tooth, and we clean out as much as we can to make sure that inside of the tooth is clean and bacteria free. Because when the bacteria is inside the tooth, it causes infection, and then it can actually cause systematic infection as well. And it can be very dangerous. So we do the treatment to prevent that from happening. Signs of needing a root canal would be any kind of dental pain, any kind of pain that comes and goes, any kind of swelling that you have. Sometimes it manifests as like a pimple that's coming out of the gum. So that's one of the indications that you're going to need to come in with an endodontist to make sure that your tooth is doing okay. So what we do differently in our office is we offer very high technology that is differentiating from other practices. So root canal typically takes about 2 to 3 visits, depending on how difficult the case is. And sometimes it does, but in most of the cases at our office, typically what takes 2 to 3 visits is compiled into 1 visit. And the reason why it is possible is because we do have high technology such as the GentleWave and the CBCT, which allows us to map out exactly where the canals are. And we have a microscope, the Zeiss microscope, that allows us to better visualize what's in the tooth itself. So I wanted to briefly touch about what GentleWave is and how that machine is different from traditional irrigation system. Traditional irrigation system uses a syringe, the good old syringe, and the needle. We put in the chemical in there, we irrigate it, and we clean it out in like very ancient way. And it has been like that for a very long time. But recently, with like the development of technology, we have a machine called GentleWave. So what it does is it shoots out the chemical that it needs to be cleaning out the tooth, and it puts out like the sound energy, like waves of sound energy, and it's able to shoot out the liquid and suck out everything that's inside the tooth. Think of it as like a regular car wash versus car detailing when it comes to like root canals. And the success of the root canal treatment depends on how well you clean the canals that is bacteria free, and having this kind of new technology really elevates the treatment outcome. And also the old school way of treating facial swelling, when the patient has a swelling, you have to put in like the medication in, you have to leave it on for like a week or 2 weeks, and you have to go back to a dentist to fill it. But with this new technology, we're able to do it in 1 visit, which is a great advantage. So that way you save your time and you can enjoy what you like doing instead of coming to us. I mean, we would love to see you here, but it's more, the visit becomes a lot shorter. And I think that's the best thing about it. And also we make sure that patients are comfortable. So we offer different sedation options if you're really anxious. We have nitrous, we do oral sedation, something that could really calm you down for like the root canal procedure. Some people ask me if a root canal procedure is permanent and whether it's never going to fail. I wanted to really mention that nothing is permanent, but root canals do have a high chance of success rate, which is 90 to 95%. And with all the armamentarium we have at our office, it really increases chance of success rate. So I personally want my treatment to be predictable. And one of the things that I make sure that I think is necessary is to make sure that I know where I'm going, that I'm not missing anything, to make sure that I have peace of mind that I did everything I can. And that's why we have all these technology. I think that's how we roll at our office. And yeah, that's the treatment philosophy we have. We do everything we can at our power with all the technology and everything that we have. We provide the best care that we can at this age and time.